We're going to look at a non-traditional approach to assisted living. It's an effort called Project Greenhouse, an assisted living group house designed to make seniors feel at home.
These days, the word green has become shorthand for all things alternative. Now it's being applied to elder care. The Greenhouse Project is an effort to deinstitutionalize large, traditional nursing homes by creating smaller social living environments for elders and caregivers. Developed by physician, author, and former nursing home medical director Dr. William Thomas, the Greenhouse Project promotes living situations for seniors that are warm in their decor, furnishings, floor plan, and staff. Smart, making full use of available technology, including computers, pagers, and adaptive devices. And green, filled with sunlight, plants, and access to outdoor spaces. Today, with funding from the Robert Wood Johnson Foundation, the Greenhouse Project is working to establish greenhouses in all 50 states. Catherine's House is an assisted living group home in Montgomery County, Maryland, that is modeled on the greenhouse concept. It was formerly a private residence, and it still has that friendly feel.
I like Catherine's House a lot because it's here, out in the country. It's like a family home.
Catherine's House is home for many people, including ourselves, our residents.
There's no weekend shift, there's no night shift. We're always the same people every day.
In 1998, Kelsey and Eric Holtze opened their home and their hearts to seniors after a friend's mother was neglected in a nursing home. They called the new establishment Catherine's House, after Kelsey's grandmother, Catherine Ford. The home holds up to 6 residents. Etta, 96, and Sarah Jane, 83, are 2 residents currently living at Catherine's House. Etta's daughters, Nancy and Kiri and Kay Main, are grateful for the care that their mother enjoys there.
Huh? Are you having a good week?
Sorry. How are you,
Come
sweetie?
back here.
Our mother has Alzheimer's disease, and she fell back in 2002 and broke her hip and her wrist, and we put her in a nursing home for rehabilitation. We didn't care for the nursing home, so we started looking around for another place for her to stay.
Etta came here, as my husband had said, at the age of 91. And she, they wrote on her paper she was at end of life, and she was 80 pounds when she got here. And she wasn't at end of life, they just didn't know her.
We have since put weight on her, and she's been happy and healthy ever since.
The best benefits for the home like this is that we're small, because we have as many caregivers and we have such a low ratio of residents. We're able to know as much as we possibly can about them, form relationships, and we give them the autonomy they need and let them make as many decisions as possible.
For the past 2 years, Ellie Koku has worked as a caregiver at Catherine's House. He has formed special bonds with the residents and their families. He and Sarah have taken many walks together.
How fast can we go? My father lived here for a little over 2 years. We came on Saturday nights, and we always brought some cards, and we'd play cards with him, and then, you know, Mom or whoever would be around the table as well.
For the holidays like Thanksgiving or Christmas, Kelsey lets Ellie come with us, and we will bring Mom and Dad over to our house for the dinner or whatever, so we can all be together.
Because the Holtze's greenhouse feels like a home, doctors' visits here feel like house calls.
They said, Etta's doing great.
Here at Catherine's House, there's a visiting doctor that comes once a month routinely to do a checkup. And then if there's any problems, of course, they're always, you know, on the phone calling whenever that's needed. I feel very comfortable with that because it's very difficult for my mother to get out and go anywhere anymore.
I have a independent practice doing house calls for homebound elderly, and have been following the patients at Catherine's House for probably about the last 2 years. House calls are really kind of coming back as far as a means of caring for the elderly. Patients and families really like the personal care homes or the small assisted livings like this particular one. It's more of a personal atmosphere. The treatment for the arterial circulation is to keep her feet down, and the treatment for the veins is to keep them up. So we're kind of between a rock and a hard place. Right.
Of course, no matter what a senior facility or home may call itself, it's important to examine it carefully before making any commitments.
I think when you're looking for placement for a family member, the first thing you have to look at is this the appropriate setting? Is there enough support in this setting for your family member? Do their medical needs require that they be placed in a higher level of care, such as long-term care or a nursing home?
The first thing I would tell them to do is show up without calling. Show up in the evening, show up on the weekend.
I've been to a number of assisted living and nursing homes. This seemed like a more personal atmosphere and an atmosphere where she'd get more attention.
In spite of the greater individualized attention and more comfortable surroundings that their residents enjoy, greenhouses tend to be less expensive than traditional assisted living facilities. Still, specific cases may vary.
People see these small facilities as a better alternative financially, and sometimes there's added-on charges for as the patient requires more care, so you end up really paying more than you thought it was.
The most important decision we had for us was to find a place where we thought that she would be well cared for. We want her to have the best care, and since we can't take care of her, we thought this was an ideal solution.
At its core, the Greenhouse Project seems built on a common sense idea that seniors need and deserve good company, good care, and a pleasant place to live. Whatever such a movement calls itself, it's not surprising that it should garner positive reviews.
Fun walk by myself. I'm big girl.
Joining us today is Bill Thomas, a graduate of Harvard Medical School, noted author on the topic of aging, and president of the Center for Growing and Being, also the founder of Project Greenhouse. Welcome, Dr. Thomas.
Glad to be with you, Alexis.
So, greenhouse, most of us think of that as a place where you grow plants in the winter. What is it to you?
Well, you know, I've done my work as a physician with older people, and one of the things that's really made me mad is the way that people equate old age with decline. And so we called our work Greenhouse because a greenhouse, when you walk into it, the first thing you think of is growth and light and life. And we wanted to be able to create environments where people could see and feel growth in the frame of old age.
So what are some of the common characteristics that you'll find in each of these greenhouses?
Well, I think number one, small size. You know, our research shows that small size is much more able to create a warm, caring, nurturing environment than large size. You know, again, some people might have a preference for large size, but small is better when it comes to creating a warm environment.
When you talk about small size, though, one of the things that jumps out for me is social interaction and the lack thereof. If you only have 2 or 3 mature adults in an environment, does that concern you at all in terms of mental health and being with your own peer group?
Well, I think it would if the only people you interacted with were the other people living there. That might have limitations, but again, the small size, and I think your segment really pointed this out, the small size encourages a lot of involvement on the part of family and neighbors, and what we find is that families get more involved in a small environment than they do in a large environment, and that helps take care of that.
One of the other concerns that I think of, first of all, it's a phenomenal idea, but in terms of concern, it scares me that independence, you talk about familial support, it looked like there was a lot of support there. At times, can it be too much support where you become codependent as opposed to being independent and on your own?
Well, you know, from my point of view and where I come from, I don't use the word codependent, I use the word interdependent. And the thing I look for in terms of healthy relationships for older people are older people relying on others and other people relying on them. So I like to see situations where elders are not just receiving care, but they're also giving care.
Oh, that's nice.
And again, the small environment and family involvement can help make that happen.
What made you turn into this entrepreneur with this big idea? Was there something about assisted living that you didn't care for?
Well, you know, I got my start in the field working in nursing homes, and it became clear to me that the field really needed some big change.
Some
big change. Yeah. And anybody watching the show who's spent time in a nursing home knows what I'm talking about.
So for those who haven't spent time, what are you talking about?
Well, I'm talking about living in an institution. How about living the rest of your life in an institution? How's that sound?
Right.
Not too good. So the answer had to be not just making institutions better, you know, here's a better institution. The answer had to be break the mold and make something different, and that's what we've really concentrated on.
A lot of people who live in nursing homes, certainly there's the institution type nursing home, but a lot of them, especially assisted living, there's this new sort of environment that's been created where there are walking paths and there are gardens and things of that nature, quite similar on a larger scale to what you're talking about. Do you have issue with that, with the larger kind of environments, or feel very comfortable with that?
No, I'm comfortable with that as long as people are aware of the need to make smallness inside the bigger environment. You see, there are a number of organizations that are doing a pretty good job at making small households inside larger buildings.
Right.
And I think that's got a lot of merit, and it works for a lot of people.
That's an interesting concept. Hold that thought. We're going to be right back with you. We need to take another break, but don't go away, because we will be back shortly to continue our conversation with Dr. Thomas.
True or false? There are more women in nursing homes than men. Do you know the answer? It's true. Currently, there are over 1 million women in nursing homes, which is 3 times the number of men. Roughly 377,800 residing in nursing homes.
We're back to continue our conversation with Dr. Bill Thomas regarding Project Greenhouse. You're so dynamic and your ideas are all so dynamic, so I have so much I want to cover with you. But before we move on to the next project you're involved in, one of my thoughts is that the future, the demographics, the aging of America, how many pods of houses can we create with 2 and 3 people living in it?
Well, here's the thing to really understand about what's going on out there. The American long-term care system, the modern American long-term care system, really came into existence in the 1960s and 70s. And thousands and thousands of these buildings are wearing out. And we're going to be asked the question, do we build a whole nother group of large institutions to replace the ones that are wearing out, or do we do something different? And my answer is, it must be different. We cannot simply just recreate the same system that we've had for the past 30 or 40 years. So in order to make that claim, we have to have a viable, economically feasible model that can work, and that's really what's driving the greenhouse.
But how does that become economically feasible when you have? It seems to me that you have to have a lot of couples that are willing to take these mature adults in, especially with Alzheimer's. That's quite a challenge.
Well, one of the things that is going on out there, which we didn't see featured in the clip, but is another thing that's happening, is many organizations around the country are actually closing down old nursing homes and assisted living buildings and building groups of houses in communities, and then operating, say, a group of 8 to 10 houses all together under one umbrella, so to speak. And that's been a way for us to actually capture a lot more efficiency than just having a single couple taking care of a small number of individuals.
One of the other projects that you've been involved with, and when I was getting my PhD, we read a lot about it, was the Eden Alternative. And tell us a little bit more about that.
Well, the Eden Alternative, the best way to explain it really is it's a heart transplant for nursing homes. And, you know, kind of the typical nursing home, we go in and inject a massive amount of life. You know, plants, animals, children, dogs, cats, birds, gardens, and we inject so much life into the nursing home that we change the culture of the nursing home and make it a place that's much more about life and living than disease and decline.
When you're talking about nursing homes and disease and decline, how do you think that tipping point happened where nursing homes became something that was less favorable?
Well, you know, the modern American nursing home started off as a good idea. It was better than what we had before. But what happened was our expectations rose, and it wasn't enough just simply to say, I've got a roof over my head, I've got 3 meals a day, the nurse comes with my medicine. What more could you ask?
Right.
Well, now we can ask more, and one of the things people want is a quality of life. That quality of life is important, and it's not something you can just leave off, or we'll get to that later. It's actually central. So the Eden Alternative has flourished all around the country, really because we've put an emphasis back on quality of life.
So with the Project Greenhouse, though, and you talked a little bit just now about nursing care in nursing homes, I'm not clear on how a physician comes there once a month. Is that disconcerting a little bit, especially for an Alzheimer's?
Well, you're talking in the clip.
Oh, okay.
You're talking about people living at the assisted living level of care. And for people at that level, a routine visit of once a month is pretty much standard. Let me just tell you, in a nursing home in America, a nursing home resident who would be at a higher level of care only gets a routine physician visit every 60 days.
But the difference is they're on staff and they're there, right?
No,
Physicians
not at
or
all.
nurses are there.
Nurses are there,
24/7.
but the doctor only your doctor may only visit every 2 months in a nursing home.
Do the people that are running these greenhouse projects Project Greenhouses have any kind of medical background?
Yes. In fact, that's one of the things we insist upon is that there be a relationship with skilled medical professionals. I mean, look at, helping older people have the best life possible. It's a complex thing. I mean, it involves many different levels of expertise, one of which is medical and nursing, but also kind of what was you saw in the clip, good food. Gaining weight, I mean, that is music to a geriatrician's ears when you hear gaining weight. Oh, yeah. It's sort of the opposite of the whole rest of America.
Absolutely.
For a geriatrician, when a person who's underweight gains weight, it is magic.
It's a good thing.
Oh, it's a wonderful thing.
Are there any people that you would consider would be a bad fit for the Project Greenhouse?
Well, I think people who feel a need to be in a very large space with a lot of people around and don't feel comfortable unless they have that kind of environment, they could feel isolated there.
How, if one of our viewers wanted to find one of your Project Greenhouses, how do they do that?
Oh, it's the easiest thing to do is go to EdenAlternative.com.
Okay.
It's a nonprofit website, and just click on Greenhouse.
Well, I know you've just been funded very nicely by the Robert Wood Johnson Foundation.
Yeah.
What are some of the future things that you're looking to do?
Well, we're looking at growing Greenhouse in all 50 states, and I'm really excited to announce on your show, yes.
Yes, I got an
Breaking news.
exclusive. Go for
Breaking
it.
news. The thing that I'm working on next is creating housing for people who are, don't have healthcare needs, but housing that really creates a solid sense of community and helps people age in place in their own homes, so that even in the future, even fewer people will even need something like the greenhouse.
Before we close, though, we have to talk a little bit about what it means to age in place, though.
Yeah.
Why do you think that aging in place is so important and sort of being almost age segregated as opposed to integrated?
Well, I have that. Believe me, that's one of the things I'm working on. The housing I'm looking at and working on integrates multiple generations. For my part, I believe that aging is about community. That to age well is to be in community. And that communities come in all different stripes and polka dots and different kinds, but the essence of a healthy aging experience is being woven into the life of a community. And a lot of our current senior housing doesn't provide that, doesn't offer that.
Well, it's an interesting new model, new concept, and in addition to assisted living and other concepts, it's certainly a nice way to look at things. So,
well, I'll come back and tell you about it sometime.
Love that.